Ask your pharmacist for more details. When using this medication, it is important to follow your pharmacist or physician's instructions. They can provide you with the proper dosage and timing for using histamine dihydrochlor-menthol spray, non-aerosol. If you experience any side effects, consult your pharmacist or physician. You can also report any side effects to the FDA in the US at 1-800-FDA-1088 or at www.fda.gov/medwatch, and in Canada to Health Canada at 1-866-234-2345. Now let's talk about the uses, benefits, daily dosage, and optimal timing for histamine dihydrochlor-menthol spray, non-aerosol. This medication is commonly used to relieve symptoms such as nasal congestion, runny nose, and sneezing caused by allergies or the common cold. The usual dosage for adults and children 12 years and older is 1 or 2 sprays in each nostril every 8 to 12 hours as needed. It's best to use it at the same time each day to help you remember. Always follow the directions on the product label and consult your doctor for any questions or concerns. When using this medication, it is important to follow your pharmacist or physician's instructions. They can provide you with the proper dosage and timing for using histamine dihydrochlor-menthol spray, non-aerosol. Remember to consult your pharmacist or physician before using histamine dihydrochlor-menthol spray, non-aerosol. It's important to keep a list of all your medications and share it with your doctor and pharmacist. This spray can be used to relieve symptoms such as itching, redness, and swelling caused by certain skin conditions. The recommended dosage for adults and children over the age of 2 is to apply a thin layer to the affected area 3 to 4 times a day. It's best to use it at the first sign of symptoms. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, residents can call 1-800-222-1222 for their local poison control center, while Canadian residents can call their provincial poison control center. Unfortunately, there is no information available about the uses and benefits of histamine dihydrochlor-menthol spray, non-aerosol at this time. It is important to consult with a healthcare professional before using this medication. When using this medication, it is important to follow your pharmacist or physician's instructions. They can provide you with the proper dosage and timing for using histamine dihydrochlor-menthol spray, non-aerosol. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.